All right. Hello, everyone. Welcome to the 28th webinar of the month, as it is the 28th of March. And we're really excited to have you with us today. And thank you to everybody who's been really supporting us just by attending our webinars. We hope that it's been an educational experience for all of you. And the topic of today is some important things that anybody with lymphedema and or lymphedema risk should know. We couldn't fit it all in that title slide there, so we just shortened it. And there was also a typo, as you might have seen, for those of you who joined us earlier on. And anyhow, we're really happy to have you. And what I would like to do is to first introduce my team to you, because they are an important part of what makes the NLN tick. So two people who could not be on with video are Nicole Ballard, and she is our membership manager, and also Erin Sokolsky, who is our marketing manager. To my left is Alyssa Fiorito. She is the NLN Garment Program Manager. To her bottom is Jennifer Williams. She is our Continuing Education Manager. Below me is Veronica Cineres. She is our Social Media Manager. And at the bottom there is Christy Blair, who is our Project Manager. Thank you so much, ladies, for everything that you do. So glad that you can be on with us. Okay, and I am actually going to remember to insert our disclaimer right now. And that is that basically all of these webinars for the month were intended to basically be informational in nature, just to give you some broad strokes and overview of various areas of focus as it relates to lymphedema. But they all are not intended by any means to replace the professional intervention that you should be receiving from your healthcare team. So it's a really big, important thing. So please make sure that you are being followed by a medical doctor, by a lymphedema specialist, and making sure that you're working, with them to make sure that you're getting the best care possible. Another disclaimer is, today we're really excited to welcome Juzo USA. They are a silver sponsor of the National Lymphedema Network, and we're going to be welcoming Cindy Anderson, who will be talking about Juzo USA. And even though we absolutely love Juzo and all their products, we do not necessarily endorse their products. The National Lymphedema Network does not endorse their products. It's just us bringing them and you the opportunity to connect so that you can be aware of all the choices that are available to you, you being the patient community. For the clinicians who are on with us today, welcome, and we welcome you just the same. Okay. So, there's a lot of things, that I think that the patient community should know. And honestly, I had a little bit of a struggle in terms of how to organize everything. So what I would love is to definitely hear from you. If you have any questions at all, as it relates to like general things that basically everybody can benefit from, please go ahead and ask the question in the Q&A. You can also put into the chat. And on that note, we've been playing around with how to best modify the settings of the chat to make sure that we preserve privacy, but also make it as interactive as possible. And so finally, on the 28th day, we have three webinars left. We figured it out, and we're going to tell you that we do see your names. And so if you would like to remain anonymous, rename yourself. You have the ability to do that. You can become Rocky Balboa. You can become Christina Aguilera. You can become Jennifer Aniston. You can become anybody you want, and you can just be a symbol if you like. And that way, when you chat with us and the rest of the attendees who are on, we won't have to worry about your privacy, because some people do ask very personal questions. But again, on that note, please ask general questions that can potentially benefit everybody. So don't give specific medical histories and then ask, what would the advice be? You can ask, what is your, recommendation as it relates to antibiotics, for example? And so that would be something that everybody can benefit from. Okay.
Hey, Jeanette, I'm sorry to interrupt. It's Alyssa.
Yeah.
Oscar and all of us would like to wish you a very happy birthday. For everybody that doesn't know, yesterday was Jeanette's birthday.
Thank
So
you.
Oscar put a comment in here to say happy birthday to you. So we are all saying happy
Thank you.
birthday to you.
Thank you so much. Thank you. I'm not really one to like broadcast that.
I'm sorry.
Yeah, no, that's totally
Got to
fine.
celebrate.
Thank you. But what I wanted to share was how that came about. My daughter, who is sometimes here in the NLN office with me, just because she wants to come here for fun, and also because my older daughter wants to go out on, her hangout. So she had to stay with me. So anyway, at the end of one of the webinars, it was probably the one on the 26th, we were wrapping up and we were just like preparing for the next day. And then she comes on and she shares with my team, happy birthday, or tomorrow, we're not going to be here because it's my mom's birthday, but it's also truly, I was not available because of Passover. And so anyway, and then from there, my team then said happy birthday. And then anyway, my point is I'm not really a big thing on that, but I'm very grateful for the birthday wishes. Thank you so much. And I appreciate it. Okay. I'm 21. Okay. So let's see. So what we're going to do is we're going to start with deep vein thrombosis, right? Also known as DVT. So allow me just to share the camera there so you can see me and you can also see what I'm writing. Okay. So, what you'll see now is you'll see me talking and you'll also see like what I'm writing, and you can make that, each person can decide how much bigger you want that second camera view to be. So you can just kind of like drag it and make it wider if you'd like. Okay, now deep vein thrombosis is basically also known as a blood clot, right? Or it's also known as DVT. So that's the first thing. So whenever you hear people talking about this, it's also known as DVT, AKA blood clot. And this is really important to know about because in secondary lymphedema meaning that you develop lymphedema as a result of trauma to your lymphatic system, as opposed to being born with lymphatic compromise, as in primary lymphedema. So in most cases, in secondary lymphedema, it's usually from secondary lymphedema is usually from oncologic interventions, from cancer treatment. And so with the history of cancer, it has also been known that there is a slightly higher risk for hypercoagulability, which means that your blood can sometimes be a little bit thicker, and that you have a slightly increased risk for developing a blood clot. And but blood clots are really basically tricky because it's very interesting that even the most healthy athlete, like the super athlete, where they train really hard and they are so fit, and it's interesting to know that when they travel, it's been known that they have a slightly higher risk for developing a blood clot as well. And the reason why that is because they are so fit that their heart rate is much lower. And so that their circulatory system or their blood is a little bit slower, which is usually an indication of health, of increased levels of health and fitness. And so when they travel and if they're sitting for a prolonged period of time on the plane, they actually have a higher risk for a blood clot. So, it's just, just to let you know, it affects various populations in multiple ways. And even if you didn't have a cancer history, whenever you come out of surgery, for example, you've been, especially a surgery that is really long, you've been lying flat for a really long period of time and your blood has not been moving as it normally does, you have a risk for developing a blood clot after that as well. So developing a DVT is always something that you should be on the lookout for. This is especially true when you've had any prolonged time of immobility. So if you've been in a long car ride, if you've been on a long flight, if you are coming out of a long surgery. Those are just things to keep in mind. So basically prolonged periods of immobility. And what the usual signs are is increased swelling. And increased swelling by itself could be the only clinical sign of a DVT. And it's not so common where that's like the only thing, but it is a possibility. And that's why you shouldn't be aware of this, because you might just attribute it to like a normal daily fluctuation, let's say, like, sometimes your swelling goes up and sometimes it goes down because of weather, because of what you've eaten and things like that. But, again, just be mindful that significant increased swelling could be the only sign of a DVT. However, it is usually, so let me just write this down. So I want to put 2 arrows for increased swelling. But it is usually accompanied by other signs and symptoms as well, such as tightness. Now, it is most common in the legs. So developing a blood clot in the legs is where you'll usually be of concern, but it is possible to develop upper extremity DVT as well. But just to keep in mind. So this tightness, I encourage everybody to always be really mindful of how their body normally presents, right? Like, when, let's say you get up in the morning and there's a little bit of stiffness in your joints and there's like a little bit of tightness and you kind of have to like loosen up a little bit. Like there's a degree of tightness to that, right? And there might be other occasions where you might just have a little bit of tightness, like you've been watching a movie for a long period of time, and then you get up and you just need a little bit of time to for your joints to like warm up. But with a DVT, this tightness is usually significant. It's like there is a distinct difference in terms of the tightness. It's like it's ever present and it stays with you. And in some cases, it gets worse with time because sometimes the blood clot gets longer, right? So the blood clot can basically take up like a small, inch of a vein, but if it's left untreated, it can actually grow. And some blood clots can be, like more than a foot long. And it's really dangerous because if a blood clot gets dislodged, it goes to the lungs, and then basically, your lungs don't function as well, and it can cause a fatality. So you want to make sure that you're on top of this if it presents. So whenever you're not sure, always bring your concerns to your doctor, and make sure that you're very clear in describing your signs and your clinical signs and symptoms of what's really different, right? This tightness in your leg or this tightness in other places of your body. So tightness is one of them. And then another thing, so increased swelling and increased tightness, they kind of usually go together. On top of that, the leg will have a different color. It's going to look a little bit more red, and it's going to look more red because it's going to be more warm. Now, this is very different from an infection, right? Because in an infection, it's really red usually, and there are defined margins, and basically it starts to take up more real estate on your skin. But with a DVT, it's kind of like diffuse. You don't know where the borders are. So usually, like in the leg, your whole thigh might feel stiff and look like a little bit more pink, and your whole lower leg might be a little bit more red, but there are no clearly defined margins in a DVT. And so that's something to keep in mind as well. So you'll have redness or pinkness. I'm going to say pinkness also. And, the medical term is erythema. And you can have various shades of that, right? Okay, so that's that. Now, these are the 3 typical signs and symptoms of a DVT. Now, something that I'll share with you is a story that I kind of learned the hard way, and this is going to be also relevant to what you need to know. So I once treated a patient, and it was a woman who had a gynecological cancer history, and she had lymphedema in one leg. Let's just say it was the left leg, and so I was treating her, and the prescription was for bilateral lower extremities, right? So I did not really think twice, because the doctor had already covered the fact that the right leg was potentially going to swell as well, and and it did. But we were focused on the leg that was apparently swollen, which was the left leg. And then midway through treatment of her left leg, her right leg became more swollen. And so when I decided, I started to treat it. And when I bandaged her leg, I started to bandage her leg, and it's a great thing that I was able to see her toes. That basically, after I put some compression, her toes were totally black, like black as like my shirt and as black as my background. So I was like, okay, we're gonna take this right off. And obviously that is not a normal physiologic response. Now, allow me just to digress for a moment and say that if you are applying compression onto your limb for the first time, or even on a normal basis, at first your digits, your fingertips and your toes may become a little bit discolored. They're going to become a little bit darker, but not black. They're going to be just a little bit darker because your circulatory system is trying to figure out hey, there's compression on here, is this safe or is this not, and so it's going to become a little bit discolored. But with time, and within 15 minutes, certainly after longer than that, it should become lighter in color, and it should normalize, especially since the bandages will loosen, right? And you'll nestle into the bandaging and the compression much better. But if it gets darker, you need to take the compression off, and you need to tell your medical team right away, because it is potentially a blood clot. And I don't know, I just hope that story helps you, just to keep that in mind, and know that if you ever see that, to recognize that it's a potential blood clot. So let's write here. I'm going to write here dark discoloration, but I'm not going to qualify that. But you'll remember from my story that especially with compression, it's going to be very significant. All right, so that is deep vein thrombosis. Are there any questions with DVTs?
Yes, Jeanette, we have some questions here, not all related to DVT, but we shall ask them. So one of the questions is, assuming I'm vigilant in my care, can it be stable forever, or can I expect progression as I age?
Oh, with lymphedema?
It doesn't state it, but I'm assuming.
Okay. Yeah, absolutely. I mean, the thing is that, with age, unfortunately, everything becomes a lot more difficult. No matter what system you're looking at. And so it will be a challenge for you to maybe maintain it, in the sense that you might, if you have not been keeping up with other things, for example, if you haven't continued with your exercise program and maintaining your strength and flexibility, then that's going to make it more challenging for you to take care of the tasks that are needed for lymphedema, right? But if you continuously, stay on top of everything globally, for good overall health, there is no reason to think that you can't also manage your lymphedema. It is not inevitable that your lymphedema will get worse. If you just constantly have a nice open communication with your body, because as you age, it might say, hey, I need a little bit more MLD than you used to give me, or I might need consistent compression. I know I let you get away with not having everything on the weekends. So the idea is just to always just stay very much in tune with your body and know what it needs. Stay in contact with your lymphedema therapist. It's a lifelong relationship, which is one of my later slides. But really, if you do everything so diligently, really, I think that there should, and also assuming that there aren't any other major complications along the way. For example, one of the concerns with older age is, like a hip fracture. And so that might interfere with like your flexibility and things like that. So again, assuming that there aren't any other major complications, if you're diligent, I'm very optimistic that people can, keep their lymphedema under very good control. Yes, age is nothing but a number.
Doctors don't want to prescribe antibiotics prophylactically. How do you protect in advance if having an invasive procedure?
That's something that is definitely a very individual discussion with your team. I think that you're like, managing infection during such a big procedure is definitely one of those times that you're probably going to want to consider, being open to the prescription of that if that's what the doctor thinks is good. But, it's not always necessary. And, again, I think it's very important to understand that there is a very high probability of developing a resistance to antibiotics and them not being as effective when you need them most if it's overused. So, I think that you can't I think that in all situations, like in all relationships, clearly expressing your concerns, your fears with your medical team and like helping them understand what your major concerns are, and then asking them to clearly explain to you why, maybe they think that the prophylactic antibiotics are not necessary. And I think that if you come to this understanding, maybe it won't be as fearful of a situation.
Right.
Speaking of antibiotics, Jeannette, I did want to mention that sometimes I see patients confuse the discoloration of legs with cellulitis, and assuming that it's an onset of cellulitis, which I know you're going to talk about later, but it's always prudent to check it out to see if you have DVT versus just assuming that it's another bout of cellulitis, because that can affect your MLD and of course, any pumping that you may have to do.
Yeah, definitely. Especially with everybody having like different shades of,
Right.
skin color, from really dark to really light. I think that indeed knowing your body and the different colors that it turns under different circumstances is really important. So when in doubt, definitely just bring it to your medical team and let them do the differential diagnosis and tests. I mean, ultrasounds are not, that costly. So a doctor is, not going to hesitate if they suspect a DVT. So, definitely open communication is very important. Thanks, Veronica. Is there another one about DVT?
About DVT, there is, what are the recommendations and precautions to be taken during exercise program in the case of a DVT diagnosis?
See, this is a tricky one. I mean, and it's not one that I or the National Lymphedema Network can comment on at this time because it's really tricky. And I'll give you an example. So when I used to work at the hospital and I attended like various rounds, there was this one rounds where the topic was, they always discuss the different patients, and this one patient just developed a massive DVT. And then so the attending was asking, okay, so what should we tell this patient to do, right? So then the resident said, well, we should tell the patient to be on bed rest. And then to that, the attending admonished the resident and said, how do you think that this patient developed the DVT to begin with? It was from immobility and not moving, right? And so, exercise was the antidote to the DVT, but, you always have to be concerned about the DVT like dislodging. And so that's something that is very, I don't know, you just have to like work with the with your healthcare team on that. And maybe one day we'll collaborate with a venous organization to see if there are any clearer guidelines on that, but it's not one that I can comment on. But it's a great question.
This one is sort of related. Once a blood clot is diagnosed, how long does it take to get it dissolved with medication? And would you continue to wear compression on the affected limb?
Yes. So it really depends. There are, there are several ways of handling it. The first is, first of all, it has to be diagnosed. And then there's like the injection of a low molecular weight heparin, which is kind of considered to be therapeutic the moment that injection is, received. And then there's also, like if it's like a serious one, you might have to be hospitalized for anticoagulation and be monitored and await like a procedure. They can do a thrombolectomy where they remove the clot. And so and then and if it's a very minor one, maybe of a superficial vein, I'm so sorry. Well, we're talking about DVT, which is deep vein. So if it's of the deep vein, if it's a very small one, sometimes they might the doctor might prescribe anticoagulation, like via oral pill. But then they have to make sure that they look at your your blood, that to do blood tests to make sure that you're therapeutic, and that basically that they didn't that they didn't go overboard in terms of thinning out your blood, because there's like a fine balance to like achieve. So whichever is best is going to be determined by your specific presentation, and also going to be determined by your medical team looking at all of your medical history. So, but there are several ways of addressing it for sure. And then what was the last question, Jennifer?
I'm sorry, what the one that we just...
What are the different ways that it's, how long would it be? So I'm not so sure about that. It all depends, because again, like the longer the thrombosis, the longer you might need for it to resolve. But then again, if you get a thrombolectomy, that's a pretty quick procedure that takes care of the whole clot right away. So it all depends. But I thought that there was another separate question at the end.
There is. It was, would you continue to wear compression on the affected limb?
Yes. And so that's another thing too. I think that sometimes the compression garments, like if they don't fit properly, they can actually add to the DVT, like if they're cutting in. And so it has to like fit nicely. So that's also a determination that's just determined by your doctor. Other times, like they want compression so as to make sure that you're helping the venous return, and you're helping the blood to continue up on the leg so that it's not sluggish. So again, a case by case basis, dependent upon the doctor's rationale and your presentation. Yeah.
For a DVT suspicion, says D-dimer test, blood test, or ultrasound necessary?
There are different ways of catching it, and so I think like the ultrasound is like the first line, and then after that they suspect, they might do others, and it can even go as far as like requiring a CT. But again, your job as a person who might potentially have it is to simply make sure that you communicate your concern, like again, like the symptoms that we discussed, which were swelling, tightness, discoloration.
Okay. And one other question about DVT specifically, DVT or cellulitis, rules regarding compression stockings and pumping.
Also determined by the doctor. DVT is it's such a fragile situation. I think like what I would like to highlight is that it's such a serious thing if you have a DVT. You don't want it to become a pulmonary embolus, which means that it basically dislodged from wherever it was in your leg and it traveled up the entire venous system. And as you know, all blood returns back into the lungs to get more oxygen so that they can then pump it back to the rest of the body so that you can deliver that oxygen and nutrients. So it goes to the lungs. And so if it develops or if it progresses into a pulmonary embolus, it's a serious thing where it can really, it can be fatal or cause like serious, serious breathing problems, and it can really affect your lung function and your lung capacity. So, if you suspect that you have it, you need to communicate that to your doctor. An infection, equally serious, I would say. Well, can I say equally serious? I would say it's equally serious in the sense that, if you have a really significant infection, it can progress very quickly and it can become sepsis where it can go into your bloodstream. So you want to make sure that if you have any symptom that is of concern, that is especially progressing very rapidly, you need to go to your doctor, go to the emergency room, and just make sure that it's clinically checked out. Now, in terms of compression garments, again, that was the other question, right? So this is the thing. I think, traditional wisdom is that if you have anything of concern, you just like stop everything, right? For now, I'm just going to stick with that. But I guess what I'd like to maybe share is, let's say you went to the doctor, you had your concern, let's say it was an infection only, and maybe we'll talk about this next. I mean, maybe we can just like go over to this now. So we'll go to infection. And so with an infection, let's say you go to the doctor and the doctor says, yes, you have, a very small bit of infection. And, the question is always like, do you continue with CDT, manual lymphatic drainage, compression garments, compression bandaging, or not? And, if you think about it, like physiologically speaking, it's like if you stop the compression, then basically you're allowing for all this fluid to pool in your extremity, your arm or your leg. And we can even think about the trunk as well, although the infection is not as common there, but it can happen there nonetheless, and the head and neck too. But basically you're allowing the fluid to kind of pool, which is basically adding fuel to the fire, right? It's making it easier for the infection to linger and proliferate. So that's why it's always something that has to be thought of. But what's really important is that you can tolerate the compression. So let's say the doctor sent you home and said you can continue with compression, but you try to put it on and it's just so painful. So pain is usually the body's way of saying, like, I don't like it. Get rid of this stimulus that is so noxious to me. So then if that's the case, then you take it off. And, but again, I have to just say that it will depend on what your medical team advises, because everybody is very different. And there's no way to truly like say that across the board for all patients in a way that's going to be safe, because it really depends on your particular medical history and your doctor's advice. Okay, so infection, super, super important, especially for our community to really understand and recognize an infection. Now, the first thing I'll say is that it's very important for you to know and be aware of where in your body, especially the parts of your body that are at risk for lymphedema or have lymphedema. It's really important to be aware of your level of sensation. In other words, like, let's just say you had surgery, like, did that affect your sensation in any way where you don't have as much feeling, or you're not as sensitive to touch and noticing things like that? I'll give you an example. So one time I had a patient, and she was a public school teacher, and she went to school and she had a pencil stuck in the back of her arm. And the kids were young kids. They didn't really, I don't know how to address that. They didn't have the courage, I guess, to say that, Miss So-and-so, you have a pencil stuck in the back of your arm. So she, at some point in the day later on, like, somebody then told her, like one of the other teachers said, hey, you have a pencil stuck in the back of your arm. And so anyway, my point there is, know your level of sensation. If you have an area of numbness, especially if it's chronic and it's been a long time and it's going to persist, you have to be extra careful and extra diligent in those areas. So making sure that you do a thorough, meticulous skin check over those areas, but of course over the entire area that has lymphedema as well. So the first thing when it comes to infection, and I'll write it here, is to know your areas, know your blind spots is what I'm going to say, right? Know your blind spots. In other words, areas of decreased sensation, because those are the areas that you need to focus on. Okay. All right. The next thing is, what are the signs and symptoms of an infection? And usually it's a triad. It comes together. So like, it's not just one. Like in DVT, it can be any of those, but with an infection, it's usually a triad. But the caveat is, if there is any of these three, you should definitely bring it to your doctor. But the first is increased swelling. See, so that is always like the concern, right? Because if you have lymphedema already, you're already going to have some degree of swelling, but this is going to be like increased swelling. Number two, you are going to have pain. Even if you cut your nail a little bit too close, and even if you had like a little paper cut, there should be some like degree of pain, right? And so that's already going to be something that's going to like be a little bit of a red flag, and an area where you're going to monitor very, very closely, because sometimes you're not going to know whether it is just pain from the onset from the traumatic injury, or whether it's now pain that is like from a potential infection. Now, usually with the case of an infection, that initial pain will increase. That initial bit of swelling will increase. And then you're also going to have redness. But it is possible that it might just be pink, because maybe, maybe your body's just handling it a little bit differently, but it's redness. But I'm going to also just add here discoloration, right? Again, the medical term is erythema. And then, so these three things are going to increase. Now, these three things are almost always present in an infection, right? And what also often accompanies an infection, and I'll write it here, is warmth. The temperature of that area is going to increase. But
Jeanette,
yeah,
I'm sorry to interrupt you. This is Jen. I just wanted to also, as a clinician, I see a lot of patients come in, and unfortunately they are put on antibiotics incorrectly because of like stasis dermatitis, or just chronic inflammation from extreme edema. So sometimes redness and discoloration can be mistaken for cellulitis, when in fact it is not an infection.
Right. No, and definitely. And which is why, that's why if you have any of these concerns, you have to bring it up to your medical team's attention. But it is something, so it's always difficult, because like as a clinician, like if it's brought up to me and I can't really tell, like I'm going to like, bring it to the doctor's attention, right? Because you always want to be safe, right? You always want to err on the side of being more conservative than to be cavalier. And it's always a hard thing, but usually, there are some other things that you can, do in terms of differential diagnosis. And the doctor, like obviously, like if the doctor brings this to, if you bring these symptoms to the doctor, they're probably going to do an ultrasound first to make sure that there isn't a DVT. And then, if there isn't one, then they will usually prescribe antibiotics. And it's true that, it might be overprescribed, but in those situations, it's like, if it was an infection, it was probably the safer route to have taken. But, as the patient, right, your job is to now know, like, as Jennifer was saying, like for chronic venous stasis, you'll know the color of your skin, great. Because if these were your symptoms at some point in time, you got the antibiotics, and let's say the pain subsided or whatever, but the discoloration of your skin will be prolonged there, because with venous stasis, you're going to get something called hemosiderin staining, in the sense that with the blood kind of like backing up in the veins, what happens, it kind of leaks into your tissues and it stains your skin a little bit, so they become dark, and it has like this brownish reddish discoloration that just stays there for a really long time chronically. And so you'll know it, like that's your baseline, if that's something that you have to see on your legs for a long period of time. And hopefully, with like treatment with compression and other things, it won't progress or maybe even improve, but there's always some degree of staining of the skin from venous stasis. So again, my point is, like, know your body, know what the color normally is. Normally when, let's say you like, if you don't wear your compression garments, maybe it might get a little darker, but nothing to be concerned about. So just know your body, be really in tune, so that you can then be really accurate when you say, no, this is redness. This is not just the normal brown discoloration that I have. This is a deeper, darker, angrier color than it normally is. And then that will be a very clear indication that it's not the same, so again, knowing your body, super important. I'm sorry, I feel like a bit of a broken record, but the message is like pretty important, so it's worth reiterating. Okay, so these are the signs and symptoms of an infection. But what I wanted to highlight here is that, and this is also known as, what you'll also hear this is, it's also known as cellulitis, right? Which is a skin infection. Now, this is most, applicable to a skin infection. So it could be on the trunk, the leg, the arm, the face. But you can also get an infection like a UTI, right? Like for patients who have had, pelvic dissection or pelvic surgeries, such as in prostate cancer or a gynecological cancer. And you can have a UTI and not necessarily have the typical signs and symptoms. So for UTI, right, typically the signs and symptoms are that when you urinate, it's very painful. And when you urinate, it has a very distinct, like fishy smell to the urine, right? And it also gets worse, so that every time that you pee, you think that, you'll be able to flush it out, but it gets worse. And at some point in time, if it really gets worse, you'll start to see some blood in your urine, and that means it's really advanced. And, definitely, even when you just start to have pain, you should already be seeing your doctor. Well, what's really interesting is that there are a handful of cases where you don't see that. You don't see pain with urination, and you don't see you don't witness the smell with urination. And what has happened is that patients might just all of a sudden have a hard time controlling their ability to urinate. In other words, they can't make it to the bathroom. Like all of a sudden there's frequency and urgency, so that, you know, they're going to the bathroom like every 5 to 10 minutes, which is not normal. And that's also not normal for them. So all of a sudden they can't control their bladder, and they don't make it to the bathroom, and they have to go every 5 to 10 minutes. And that is in the absence of, again, a smelly urine and the absence of pain with urination. And again, you need to go to the doctor immediately, because that's just not normal. And what I'd like to highlight is anything that is totally sudden and out of the ordinary, and it's just like, this is just not me, you need to bring that to the doctor. And that includes like sudden weight gain, sudden weight loss, sudden anything. You know, just bring it to your doctor, because something is happening where your body's like, it's just a little bit off balance. Okay, so let's just write here. For UTIs, which is urinary tract infections, right? The usual signs and symptoms are, let's do here, pain with urination and foul smell with urination, or, well, foul smell, let's say, in the urine. Okay, but then what's like really odd is urinary frequency, urgency, and let's say inability to control bladder, which is also known as incontinence. Okay. All right. Any questions with infection?
Yes, we have a couple here. I have had lymphedema in my right arm for 10 years. And in the past 3 years, I have had 1 to 2 episodes of cellulitis a year, ranging from acute to mostly mild. Clears up with antibiotics. I am fine, but notice lately, whenever I remove my compression sleeve or use my pump, my skin often looks pinkish. It usually subsides after a couple hours. Is this something I should be concerned about? Not sure why this is happening.
Yeah, you know, I think, again, you know, the body is like so smart. It speaks to us, right? And it tells you gently with like maybe a little bit of pinkness. And then if you're not listening, it might tell you much more emphatically with redness, right? So like with the garments and the pump removal, you know, something to be mindful of is, you know, is it like the fabric that maybe you're having a little bit of an allergic reaction to? Is it maybe the fit? Because is it in certain places where, you know, and try to see if it correlates to where you might feel like something that's a little bit off. Like, is the pump like a little bit more tight in an area, or is the garment a little bit more tight in an area? Like maybe, you know, when you put it on, like it's not fitting just like right in that area of pinkness or redness. So it's important to understand like what is the cause of those areas of erythema and try to figure that out, because it should not be the case that when you put on the pump or the garments that you have any redness. It should just be really comfortable, and it should be normal. Your skin shouldn't really react that way. And if it is, it's worth exploring whether it's like the materials of the garments and or the fabric, or if it's the fit. And at least explore that. And if it still persists after looking at those components, you know, continue to investigate, because you know, again, the body is usually quite smart and talks to you.
And just one other comment, Jeannette, is there any way that you can make the screen on your papers a little bit more focused? It's a little blurry.
you know what? I'm gonna get rid of my video. How about that? And then you can basically just see only this. You'll just see what I'm writing, and then it should be a little bit better. Otherwise, what I can do, I can make it a little bit closer. Give me 1 second. I will just fix the angle here. All right, so that it's super close, and that might help.
That looks great.
Okay, all right. Okay, so if we're done with infection, we're gonna move on to skincare, which is related, right?
There's one more question that just came in.
Yeah.
Since I have had cellulitis, when I travel overseas, I like to carry antibiotics with me just in case. Are there suggestions of specific antibiotics to have? My doctor is a GP and is not any kind of lymphedema expert. I've never had a doctor who was very familiar with lymphedema.
Yeah, that's not really my area, and that's really not the area of any lymphedema specialist unless they are a doctor or a nurse practitioner or a physician assistant. So that's something that's unfortunately something that you're just going to have to, have an open discussion with your medical team. Because it's important to know your unique history, and but having a filled prescription of antibiotics when traveling overseas especially is always a great idea. I think that what's also super important is that you have a very clear understanding from your doctor as to when you should use it, right? Because you don't want to take it like the moment like you saw a little bit of pinkness, let's say, if that's not what the doctor wanted you to do, right? Like the doctor should have communicated exactly when you should be taking it, right? Some doctors might say, take it the moment you suspect that you have an infection, in which case then that's, what you do. But everybody is different, and that's really not the area for me as a physical therapist or your usual lymphedema therapists, which are usually occupational therapists, massage therapists, to say. Okay, so let's talk about skincare, right? Because skincare is basically so important, and that by taking good skincare or taking good care of your skin, you're basically going to minimize your risk for infection. And even if you are so meticulous with your skincare, it is still possible to get a skin infection. And so don't be too hard on yourself if you do develop an infection. But there are just some general rules and guidelines, not rules, general guidelines that will help to minimize your risk, right? Okay, the first thing is, again, allow me to highlight the importance of, know where your blind spots are. Know your blind spots. So know where your sensation is diminished. And because those are the areas where you are going to pay particular attention to. Now, you're going to pay attention to those areas, but you're still going to give a lot of love to your entire area that is involved. So let's just say it's your right arm, right? You need to pay very good attention to how the skin is presenting over your entire arm, which includes, right? It includes, let me just get this picture. Let me get this here. So, I find as though when I do geometry, it just comes out better than me trying to make it look real. So when you are, let's say it was your right arm, remember that which would mean if your right arm is the area that presents with lymphedema, so that would mean that your lymph nodes in your right armpit, right? Because if this is the happy face, this is the right. That means that the lymph nodes in your right armpit were compromised or removed or damaged, right? And what that also means is what that also means is that the entire area, let's do, I'll just continue to do this here. Basically, it's not just your arm that you have to be concerned with in terms of developing an infection. It is also your armpit. It is also your chest. It is also your upper back. It is also your rib cage up until your belly button here. So this is the entire area that is compromised from having had lymph nodes removed in this armpit. So you need to take a look very closely at this entire area in terms of your skin, right? So, and you know, basically when lymph nodes, when the surgeries are done here, a lot of patients complain of numbness that, you know, lingers long after surgery. It's a result of various things, right? First of all, it could have just simply be that the nerves were cut, right? And when the nerves were cut, then it basically affected your sensation, right? Now, it's possible, because nerves, when they're cut, they can regenerate. They regenerate at a pace that is like 1 millimeter a day, if I'm correct with that. But the idea is that there is the possibility for nerves to regenerate. But what can often happen is that there's like so much scar tissue, right? That the nerves, even though they're like ready to grow and ready to, like, you know, reach out to normal areas and give you normal sensation, there's a big barrier of like scar tissue and fibrosis that's not allowing that to occur. So, so that it's important to take care of scar tissue. And, you know, that can be worked on. And I'll also tell you that don't ever give up hope, right? I'll tell you, this is a story that I had with another patient. Basically, I had one patient who I started to see for lymphedema management. It was like 5 years after her surgery, and she had a lot of scar tissue and she had numbness, and she said, oh, I've had it, you know, since surgery, like it's not going to like return. I was like, okay, that's really fine, but listen, while I'm working on your lymphedema, let's also work on your scar tissue management, because not only is it going to, you know, affect her range of motion, because her impairment was also range of motion. She couldn't bring her arm up all the way. She could only bring it up like this instead of like totally straight up. And so I was like, well, it's going to definitely help with your range of motion. So let's work on it for that reason. Let's also work on it for the purpose of like, let's just see if we got rid of the barrier, maybe your nerves might grow back and you might be able to get your sensation. And it did. You know, I saw her for a long time. So basically I saw her, we took care of the lymphedema first, and then eventually she was, you know, managing with a garment during the daytime. And then she also regained full range of motion. And then after that, I saw her every 6 months, because it, you know, I think it's a good idea to keep in contact with patients, because then you need to make sure that they're doing the self MLD well, that the bandaging is, you know, going okay, and that their garments don't need to be adjusted, because sometimes people lose weight, sometimes people gain weight, or their shape just changes, and so they need a different garment. And then, you know, I would see her for every 6 months, and then we would do a little bit of intensive therapy again, because she would always need like a little bit of assistance with gaining her full range of motion again. So like she was able to do this, but then like in 6 months, she kind of like lost a little bit, because, you know, with radiation, it's so easy for the tissues to tighten up, right? Even if you've like addressed it, even with full rehab, it can still, you know, regress a little bit. So we would do a little bit of that. And then eventually, like after, I don't know, I want to say it was like maybe 3 years, she had like full sensation in her armpit again, you know, like she can feel everything. Like she could, like, she was like so amazed, because like when she took a shower, she can feel the water in her armpit when she never did before. And so the body's an amazing machine. Like whatever impairment you might think is like beyond repair, like you don't know, like just give it a try, give it some time, be patient, and let's see, like, you know, as long as you're alive, let's just keep working at it, you know. Okay, so I'd like to like digress a lot. I could be talking about lymphedema all day long. All right, let's talk a little bit more about skincare. Okay, so know your blind spots. All right, now it is a beautiful day here in New York. It is like 67 degrees. And, and the point with that is that, depending on where you are, and depending on like the temperature of the ambient air and everything, like, there is different levels of hydration, right? But we all know, and I'm so sure everybody has experienced this themselves. We all know in the winter time, or in colder areas, the air is so dry that even without any trauma, you will experience like some cracks, either cracks in your heel, cracks on your lips, cracks on, in the nailed bed, right? Everything just gets so dry. So one of the most important things to do is to moisturize your skin. And that is throughout the year, every day, right? Now, after Brian's talk, he had, mentioned some lotions that are worth considering. And my good friend Ned then emailed me, his thoughts in terms of moisturizers. Now, like, this is the thing, right? In terms of like which moisturizer to use, I would say that it's most important that you find something that actually does a good job moisturizing your skin. And to that, I would like to offer, that you can consider things that are natural too. Like, I'm a little bit of a naturalist in that way. Like I like to put almond oil on my skin, right? I'm not allergic to nuts, and almond oil is just like a natural way. Like it gets absorbed into your body, right? So, I know that there are like these name brands out there that might do a great job also. But for me personally, and this is not my recommendation to like, everybody, it's just, I'm just offering that what is important to you is to find one that is absolutely effective in moisturizing your skin. But the thing is, no matter what you choose, even if it is one that is oily based, such as almond oil or like olive oil or whatever, that this is not meant to be put on right before your garments. The best time to moisturize your skin, like in the areas that have lymphedema, is at night, right? Where you'll be bandaging, or you'll be wearing like a bandaging alternative, or you'll be, doing something else, but you're not going to be wearing your one layered daytime garment for nighttime. Because if you do it during the daytime, just before your garments are put on, it's going to be such a struggle. It's going to be such a hard thing to do to slide it up over your sticky, well moisturized skin. It's sticky because of the hydration, right? Which is also the same reason why I mentioned during the demonstrations of MLD, is that when you are doing MLD, you also want to have your skin well moisturized, because then you're going to have traction. So that you can see my skin wrinkling there, you're going to have traction to do an effective MLD job during your MLD session. Right? If your skin is so dry and your working hand is so dry, you're just going to basically be sliding and potentially even causing more erythema and causing more irritation than is needed. So moisturize your skin, because that's going to make it less likely for you to develop an infection. Think about this. Think about like if your hand, right, was really dry and you accidentally got a paper cut, it is actually more likely for it to develop like into something more serious, like a skin infection, than if your skin was well moisturized and you kind of ran the paper over that area by accident. Like your skin is so bouncy from the moisture that it might not even develop into a paper cut. That is the magic of having well moisturized skin. And so along with that, right, skincare includes maintaining hydration. And that means like drinking enough fluids, which doesn't always have to be water, as I learned from Jean Lamantia. She gave a hydration talk for us last year. And, you can totally get hydration from eating fruits and things like that. There's like a total accumulation of hydration that you can get from the various things that you intake throughout the day. But nonetheless, making sure that you maintain hydration and getting enough to keep your skin well moisturized is well hydrated, should I say, is important. Okay. Now the next thing is, just making sure that you do meticulous skin checks, right? Perform meticulous skincare or skin checks, meticulous skin checks over the entire area that you have lymphedema or lymphedema risk. And if anything is out of the ordinary, you take care of it. And basic first aid is so important. And I would argue even in patients or people, not just patients, people who don't have any, lymphedema concerns. So even if your right arm was the area that had lymphedema, I think that I would argue that your entire body deserves the same amount of attention, So what is basic skincare or basic wound care, right? Brian gave us a whole talk on this. But if you do develop any kind of skin injury, whether that be a burn, a cut, a scratch, right? Any time that your skin is open in any way, shape, or form, you need to perform basic wound care. And what is that? It's to clean the area with just soap and water. That's all you really need. Clean the area, clean with soap and water. Then you put a first aid ointment. Now, I would argue that it is not necessarily an antibiotic. You can talk with your doctor to see if that is the general guidance, but at the very least, it needs to be a first aid ointment, such as like A and D ointment, which is just vitamin A and vitamin D, and it needs to be covered and protected. With a Band-Aid or a bandage or a covering of some sort. And basically, if you do that anytime you have any kind of skin tear or skin interruption, like you're already way ahead of the game in terms of preventing an infection. And really, I mean, it's very basic, but sometimes like the most basic things are the most difficult to do. So that's basically skincare, right? It's just knowing where your blind spots are and then performing meticulous skin checks, keeping your skin moisturized, and along with that, maintaining good hydration. And whenever there is any opening to your skin, you perform basic wound care, such as cleaning it with soap and water, first aid ointment, covering and protecting it. Now, if you develop something that is a lot more significant, like if you develop like a large burn, first degree burn, or if you have like significant trauma, like obviously it goes without saying that you need to go to the emergency room and get more medical attention. But for the smaller cuts and tears and smaller burns, like where it's just like you just hit your skin just up against the pan just a little bit, then basic skincare should be sufficient. All right, I spoke for an hour and 9 minutes. And there's still so much more to go. I mean, but I'm gonna try to just do this really quickly and not give you any stories, okay? All right. Any questions so far, Jennifer?
Yes, there are a few. First, several people wanted me to just mention that when they've had cellulitis, they also get chills and fever and body aches.
Oh my gosh, allow me to go back to that. Okay. That's absolutely true. That is when it is like systemic. And hopefully you never reached that point, but allow me to add to that because that's super important too. Now, this was kind of like superficial, right? This is like superficial infection and it's on this level of the skin, but absolutely, if it gets to the point of sepsis or it gets into your bloodstream, super important that you also recognize that too. So this is like when it's like major medical emergency, like you need to get like medical attention ASAP. It is malaise, fatigue, fever, chills, body aches. Absolutely. Like these are, I don't really have any more space here, but I'm going to just do it here. This is when it's more systemic. And you need to get ASAP medical attention. So I appreciate that. Thank you for pointing that out. I was kind of like only focused on like the initial parts, but I mean, at this point, you should already be under medical attention. But thank you for that.
Someone said, did you say vitamin A and D ointment?
Yeah.
I'm assuming.
Yes, I did. It's basically A and D ointment. It's, you know, oh, what did I do here? I did something wrong. Yes, it's just basically A and D ointment, which, you know, is most commonly known as diaper cream, but it's just vitamin A and vitamin D with a petroleum base, and it serves as a nice like first aid ointment.
Okay. Someone asked, won't the moisturizer damage the stocking? And is nighttime moisturizer then mandatory shower prior to donning?
Yeah.
Okay.
Well, yes. I mean, so that was what I was saying is that, you know, you don't want to moisturize just before donning your compression daytime garments. It potentially will degrade the fibers and things like that. And so the best time to moisturize is at night, where you will most likely be wearing like either a stockinette over your skin, right? And then you bandage on top of that, or you'll be wearing a stockinette and then you're bandaging alternative. But moisturizing your skin at night is preferred. If you're going to do it during the daytime, before your garments, you're going to need a little bit more time to get ready for the day, because you're going to have to wait until that gets absorbed into your body. And I don't really know. I mean, it's different for everybody, and it's different, you know, depending on like your skin, the moisturizer itself, how much you put on. There's so many variables. And so, yes, that is true. You do not put it on just before your garments, as it can ruin your garments. And that's why the recommendation generally is that you do it at night before bandaging.
Okay. Ned says, for what it's worth, several doctors have recommended cephalexin or K-Flex as a good general antibiotic to treat skin and lymphedema infections.
Yeah, you know, again, thank you so much, Ned, but we can't really make such recommendations because it's beyond the scope of this webinar, and it's a really individual thing that has to be prescribed by the medical team. But thank you for that. All right, you know, we're kind of out of time, and I was just going to talk about, you know, things that you should know in terms of garments and things that you should know in terms of your team. And you know what I'm going to do is I want to make sure that you have the attention for Cindy, and then if there, you know, after that, like, you know, we've always been going over, I'm happy to stay on and continue with this if you would like. And if you need to drop off, no problem, you can watch the recording. So let's first of all, let me tell you that Juzo USA has, you know, generously offered to give 3, yes, that is 3 ready-to-wear garments away today. So if you are interested, thank you for sticking around, all 70 of you. And go ahead and raise your hand if you're interested in entering the drawing. And in which case, Jennifer, I think you're going to do that, right? You're going to do the wheel? And
yes, I am.
Your virtual hand needs to be raised, which means that next to your name needs to have like a little yellow hand. And then that is how we will put your name into the wheel. And, you know, Jennifer, I think just the first name is sufficient. If there is more than one person with the same first name, just add the initial of the last name. Okay, with that, it is my pleasure to welcome Cindy Anderson. She has been with Juzo USA for 27 years. She is like an expert. And so she is now going to be talking about some of the products that Juzo offers. And, you know, we look forward to your presentation. And Cindy, please do tell us a little bit more about yourself. I know there's so much more to say than what I just said, but I don't have the memory for such things. So please forgive me.
Okay, like you said, I've been with Juzo for 27 years. I'm in charge of the returns department, and I also handle a lot of the problem made to measure garments. I also do a lot of training classes and education classes for Juzo. So I'm really glad to be here this evening. And let me see if I can figure out how to share my screen, and I'll tell you a little bit about Juzo. There we go. All right, and again, this is a picture of me before COVID and with a little bit more makeup.
So sorry, Cindy, but we don't see it. Try one more time, please.
You don't see it, okay.
Yes. The up arrow in the green rectangle where it says share screen, and you click that actual rectangle. There we go, perfect.
Okay.
Thank you.
How's that?
Perfect.
All right. Again, this was a before COVID shot, much less hair. Since we are working from home, this is Buster. He's my little friend. He may appear or bark a little bit here if something happens outside. But a little bit of history about Juzo. This is the Zorn family. It's a family owned and operated business. It's currently in the 5th generation. Was started or founded in Germany. And we came to United States in 1980 to Cuyahoga Falls, which is a small town between Akron and Cleveland. But this is Anna Rose Zorn, the owner, her son Walter, who's in charge of production, and Petra Zorn, who's vice president of the company. This is our company in Germany, and they have 3 facilities, 3 different facilities over in Germany. This is the US facility in Cuyahoga Falls. This is Little Lake Juzo back here in the back. One of the things we're very proud of at Juzo is that almost all of our garments are produced in the United States. A couple of our made-to-measure products still come from Germany, but probably 95% of our products are made here in the United States. Juzo always does the right thing for the environment. Mrs. Zorn is very, very concerned about the environment. So we have a wind turbine on the property. We do paperless invoicing, recycling. Again, if there's a good, better, or best way to do things for the environment, she always picks the best. Some of the products that we have, and again, we're not going to talk about all of these today. We're going to talk about lymphedema products, but we have OTC or over-the-counter products and compression garments. We have a lot of silver garments, prosthetic garments. We have wraps and bandaging. So we have a lot of products. If you're interested in any of this stuff that we don't talk about today, just shoot me an email. I'll put my email address up at the end of the show here. All right, so compression garments and how do they work? All your compression garments, you want to have the most compression distally, and you want it graduated up the limb. Okay. So basically, we want to move that lymph fluid up back into the trunk of the body. So medical grade compression has graduated compression, and it offers 2 different types of compression garments. We have flat knit and circular, and they offer different amounts of containment. Okay. These are the compression levels for our flat knit or seamed garments, and these are the compression levels for our circular knit garments. All of Juzo's model numbers end in the amount of compression they have. So if it's a 20 to 30 seamless garment, it's going to end in a number 1. That way you can tell with your garment, the higher the last digit, the higher the compression. Okay. The containment of the fabric. The amount of compression a garment offers is determined by the density of the fabric. The more dense the fabric, the greater the containment. So that's why a circular knit garment isn't going to contain quite as well as a flat knit garment. So we have circular knit garments that conform to the tissue that's going to be more comfortable. They're going to offer 2-way stretch. Flat knit garments provide more resistance to the tissue. They have a little bit more rigor, so they're going to contain a little bit better. And then we have compression wraps, which have short stretch, which have a really high working pressure because they have very limited stretch. Compression wraps, and we'll talk about that, are also good for containment or for actually reducing the limb. A lot of times compression wraps are worn for nighttime garments also. These just show you the two types of the garments. This lady over here with all the medals is in the Senior Olympics, and she has on circular knit garments. The other lady has on a pair of flat knit garments where you can see where the seams are and the garments are sewn together. So circular knit garments are seamless, they're soft and sheer, they have a nice two-way stretch, but the important thing is they come in standard sizes and custom made. Flat knit garments are almost always going to be custom made, but they can fit any size or shape patient. So they can fit the patient with the larger limbs or the lobes or the folds. They're a dense knit and they have excellent therapeutic results. This is just a picture that shows you the program that goes into a flat knit machine. And this is the garment that comes out when it's knitted. This is a hand glove and it'll be folded here and then there'll be seams. And this is the finished garment on a flat knit garment. Okay. The other option is a compression wrap. And again, this can be used as a reduction tool because it has a very high working pressure, or it can be used as a maintenance tool. Once you have the reduction, then you can wear the wrap just to maintain your limb. A lot of times, again, these are also worn for nighttime garments. You never want to wear a compression garment that could bunch or bind at night because, again, that could make a tourniquet, but these are non-stretch garments, so they're making excellent nighttime garment. Okay, the effects of compression. It's going to help manage your condition, prevent reaccumulation of fluid. You'd always don a compression garment at its most reduced state, and you need to wear them daily for the best results. Again, the compression garment's just going to preserve the size of the limb. So you want to make sure you have the limb reduced as small as possible before you're measured for your compression garment. Okay, so the next issue is choosing the right compression garment. Juzo has a lot of products. And one of the things that I've noticed in the 27 years that I've been with Juzo is when I first started, compression garments came in beige and black and a dark brown. That was your choices. They came in a lot of skin tone colors, but there were no colors. Now we have all the pretty colors and the tie-dyes and the prints. So let's talk about compression garments. The Juzo Soft is fashionable. It's soft inside and out and very breathable. It comes in all the colors. You can get them in lots of pretty colors. This is a printed arm sleeve and hand gauntlet. The lower extremity come in 5 sizes in knee highs, thigh highs, and pantyhose, and up to 3 lengths. That's really important because the length of your garment is as important as the circumferential measurements, because if a garment is too long for you, it's going to bunch up at the ankle or behind your knee. Okay. So again, Juzo's arm sleeves come in 24 standard sizes because our goal is to get you into a standard size if at all possible. And again, this is another print arm sleeve. The trend colors, we have probably 8 to 10 colors. We change every year, once a year, just to give you some prettier colors to wear, and then the print series. Juzo also has a soft seamless hand glove. This is fairly new. They come in 4 sizes and they come in the gloves and the gauntlets, but they come in a 15 to 20, a 20 to 30, and a 30 to 40 compression. Also very new is our seamless toe cap, and these come in standard sizes. Prior to this garment, we never had a standard size toe cap. They were all custom made. So this has been really well received for patients who need compression on their toes. Again, 15 to 20 and 20 to 30 compression. Okay. Our dynamic material is just a little bit stiffer, so it has a little bit more rigor or a little bit more containment in a circular knit. And this comes in compression class 1, 2, and 3. It comes in standard colors in beige, black, and chestnut, but it also comes in all the pretty trend colors like our model here is wearing. Okay. The lower extremity dynamic comes in 40 to 50 compression. This is the only fabric that comes in this high of compression in a circular knit at Juzo. So this is a really popular fabric for lymphedema patients because it does come in the 40 to 50 compression. Okay. Dynamic arm sleeves, the same as soft arm sleeves, come in all 24 standard sizes, and they're also going to come in the colors. Our flat knit, Juzo Expert, is going to still be a soft, dense flat knit, but it's always going to have a seam and going to be custom made. And again, we can do a lot of pretty colors, the trend colors of the flat knit colors, and this for you also. Juzo Strong, just like the name implies, is our strongest containing material. It's micro-massaging weave. It has a short stretch, so it's not going to conform to the lobes and folds. And this comes in compression class 2, 3, and 4 because it is a very aggressive material, but it's going to contain better than anything else that we have. Okay, but let's talk about compression wraps just a little bit because these are fairly new in the compression world, but they're going to control the edema, and a lot of times they're used, again, in the treatment of lymphedema to help with the reduction of the edema, not only to control it after you have the reduction. The cool thing about Juzo compression wraps is they're reversible. So you could wear it on the beige side, or you could wear it, turn it over and wear it with the black side out. The straps are adjustable, and we actually have a 10-centimeter extender strap. So while custom made, you have a lot of customability with them. They have easy pull tabs. If you look at the top up here, there's a little tab so you have something to hang on to when you pull the straps and fasten them. They also have a gap resistant notch in the sleeve. Oops, sorry about that. They have a gap resistant notch in the sleeve so you don't have any gapping. And again, because they are short stretch, they do not have very much stretch. They have a high working pressure, so they're going to help reduce with the reduction. They're also trimmable, which is nice. So if you do get the reduction you're looking for, you can trim this the sleeve and make it smaller. They have Velcro on them, and you can take the Velcro off when you wash it or when you need to adjust it to resize it. On the compression wraps, Juzo has the best size range. We use a very high quality Velcro, and again, you can trim it to fit. We also have a hip attachment. If you get the Velcro wrap for the hip portion, we can put a hip attachment on to help keep it in place. And thank you. I guess I can take some questions now if anybody has any questions about the products or anything that we talked about here this evening.
Thank you so much, Cindy. We do have a couple of comments and a couple of questions. Okay. One person asked, would you get a Juzo strong arm garment to use to fly for more containment, or would a softer garment be sufficient?
That's really going to depend on your swelling and how quickly your arm swells. I would think whatever type of garment you wear normally would be sufficient when you were flying.
Yeah, I think that, you know, if you have different types of garments available, that you just bring them along, and if, you know, you'll just a lot of lymphedema therapy and a lot of like self-management is about trial and error. So it's like if you have two different types of garment, then you be prepared. But you know, I think it's just getting to learn what your body needs. And I agree, though, that with Cindy, you might find that wearing whatever you normally wear on a day-to-day basis would be sufficient. Linda said that she loves your designer prints, but would love to have, she loves your designer prints, but she has to use a glove, not a gauntlet. Is a glove in the works to go along with your designer prints? Great question, Linda.
Right now, we don't have a glove that we're printing. A lot of times what people will do will get a glove that corresponds with one of the colors in their print sleeve, or do like a black glove to wear with it. But right now, we do not have a printed glove.
Thank you. Alice asked that, this is more of a comment. She wears a Juzo 30 to 40 during the winter, which is great. The summer ones naturally sheer. needed to be returned, very shiny, hard to put on with gloves, also ran very easily. Oh, and here's a question. Are there any plans to make the summer ones with a less slippery, shiny material?
The Juzo Soft would be what she's looking for. It's not quite as sheer as the naturally sheer, but it isn't as shiny, and it doesn't grab as much. It slides on much easier. So I think she would like that. On another note, with the Juzo products, I know you were talking about lotions and creams, but all of our garments can be used with lotions and creams because they are latex free. So the lotions and creams aren't going to hurt our garments, and they are all machine washable and dryable.
Thank you. That's great to know, Cindy. Ned asked, what is the name of the material or garment described as short stretch garment and Juzo's most aggressive garment?
The Juzo Strong, and that's a flat knit garment, custom made.
Thank you. Another person asked that this person understands Juzo makes a custom garment that is more cotton. Is that true? And the next part of that is my arm, the skin over the arm has become sensitive over the years. When would you get one with silver?
Okay, two-part question. Let me ask the first part. Yes, we make a cotton garment. It's an expert cotton. It's a flat knit, and the part of the garment that touches your skin is 100% cotton. So it's a very soft garment. It's very nice for people with allergies, or a lot of times people just like garments with natural fiber next to their skin. So the expert cotton would be a great choice then. We didn't talk about silver tonight, but I'll tell you, silver is my favorite addition to the products. Silver, if you get a garment with silver in it, and we do the soft and the dynamic, the expert and the strong, all with a silver covering thread. Silver makes the garments antimicrobial and antibacterial, but it's also going to pull the heat away from the skin, so it's going to make it a more comfortable garment, especially in the summer.
Thank you. And Marsha asked, what type of product is most similar to a custom thigh-high flat knit garment? Let me see. So sorry. She then qualified not custom, but off the shelf. Aha, there we go. Okay. So what type of product is most similar to a Marsha, maybe if you can just retype the question, that would be great. Thank you so much. And I'll ask Cindy another question. Or if you like, you know what, Marsha, we would love to hear your voice. Would you like to just ask away with your voice? I'm going to give you that option. If you give me 1 second, I'm going to look for you. It's always nice to hear everybody's voices. So if Marsha, if you'd like to unmute, you're welcome to ask the question.
Hi, Marsha.
Hi. What I wanted to know is if I currently have a custom thigh-high flat knit garment, but I'm asking if you have an off the shelf, a not custom garment, and you have you have garments that aren't custom.
Right.
Which
Correct.
of those garments would be closest to something that I currently have, which happens to be a custom flat knit high leg garment?
Our circular knit garment would be a non-custom garment, and the one that has the most containment would be the dynamic. So the Juzo dynamic would be the next step from to a custom flat knit.
Thank you.
Okay.
Thank you so much, Marsha. Okay, so those are all the questions for you, Cindy. Thank you so much for your time on this Sunday evening. Thanks so much for joining us today, and we're so grateful for your presence and your presentation.
Thank you all. It was enjoyable being here.
Thank you, and hopefully we'll see you in October.
Hopefully.
Okay.
Bye, everybody.
Bye. Okay. It's 6:34. We're not that late. So I'm going to just take this time to answer the few questions that were remaining. Marsha had asked, is 8 glasses of water a day sufficient for hydration? You know, that is like the typical, like, wisdom, right? But I'm not so sure. You know why? Because you know what we'll do is I'll give you the link to our hydration video that Jean Lamantia had given us, and but basically it's all dependent upon each person. So for example, if you are a very athletic person, 8 glasses is definitely not enough. So it depends on your activity, it depends on your medical history, it depends on you know, what else you've eaten in the day. So really, like all of these things, like only nutritionists or a doctor can really give you guidelines on this. We can't really do that, but you know, just know that it's relative and it all depends. So I can't really say. It may or it may not be enough. And then Alice said, oh, Alice asked, you know, how much activity is actually needed in a day in terms of exercise? Well, Alice, we will be answering this question in detail tomorrow, as tomorrow's webinar is on exercise. So please join us then. And then Alice also asked, you know, what about plane travel? She gets very nervous in terms of preventing the edema and wanting to make sure that the swelling doesn't get worse. You know, I think, you know, I think with plane travel, like there, some basic things is just to make sure. Well, this is actually a very complicated thing. I think, Alice, we're going to have to answer this in another webinar, but very briefly, you know, just maintaining hydration is important. Keeping your regular routine as much as possible. In other words, eating the normal foods that you eat, as opposed to like, you know, staying up late the night before and then getting to the airport and then eating the salty airport food and salty airplane food. Like, you know, try to keep your diet as regular as possible. Trying to keep your sleep habits as regular as possible during air travel, you know, and then in terms of which compression garments, again, as we answered for somebody else before, it all depends on what you need, and a lot of it might just be trial and error. But you know, something to just be mindful of is that, you know, if you travel and your swelling gets a little bit worse, because let's say you couldn't figure it out, it's okay. You know, like you already know all the tools to basically control your swelling. So once you land and once you get to your destination, you just go back to your routine, perform your self-manual lymphatic drainage, put on the garments, perform the bandaging, and you'll be able to manage it again. You know, the idea is just to make sure that you don't let it get out of control. But it's okay if it's, you know, there's always going to be something that is going to potentially make your swelling worse or better. And you just have to get to know what those things are, right? So definitely not to be alarmed, and just to make sure that you know, take good care. Of course, you know, as I was saying earlier, if with air travel, it's something that's significant in the sense that like after getting off the plane and all of a sudden you have significant swelling, significant tightness, significant discoloration, or anything that just feels totally off, like it's not just like from sitting still, like, you know, and, you know, it's a little bit more significant. Of course, you want to get everything checked out. But if it's just like a little bit up and down within the normal parameters of your day-to-day activities, then, you know what to do, right? Okay, and then lastly, we have Linda who asked, a common part of treatment for breast cancer is taking an aromatase inhibitor, and this causes edema. Is there a way for us to basically determine if this edema is, you know, related to DVT or if it's from the aromatase inhibitor? You know, it's really hard to say, but like, you know, again, like there are usually pretty specific signs and symptoms with, you know, a DVT. Again, it's like tightness, that discoloration, and significant increased edema. As opposed to with an aromatase inhibitor, usually the edema is the only thing, right? So it doesn't usually accompany, it's not usually accompanied with skin color changes and tightness and so forth and so on. So that's usually a distinguishing factor. But again, when in doubt, just bring it to your doctor. You know, just have an open discussion to say, hey, you know, I just want to make sure that this is a benign. I don't need to be concerned about it. And, you know, if they do an ultrasound, then you're off on your merry way. Okay. We had a couple of comments, in the chat and in the Q&A where, some of the information didn't necessarily add up for everybody. And, I think that, just to let you know, we try our best to make everything as connected and as fluid as possible. But sometimes you might think that something that I said in one webinar might be different from another webinar or whatever. If there are any questions, definitely just bring it up to us. We certainly don't want to have any confusion. And our intention is only to add value to your, self-empowerment and to educate you and to really make you, make sure you feel you're armed with a lot of more information so that you can really take control of your lymphedema. But definitely we never mean to say anything that might have potentially come across as offensive. The stories that I share are meant to drive a point home, and it's not meant to do anything else other than add educational value. So if that is of concern, please do bring them up, and we'll definitely try to clarify anything that might have been confusing. All right, it is 6:41, and thank you so much to everyone who stayed on to the very end. And so now we are going to get Jennifer on the line. And Jennifer, if you can spin the wheel 3 times so that we can have 3 winners. And for everybody who is potentially going to be getting a garment, please go ahead and take note of Christy's email right now. And Jennifer, whenever you're ready, we're ready for you.
Here it goes. First winner is Amy C.
Amy C, congratulations. Amy C, please do take note of Christy's email address. Spin it again. Or you know what? We might have to take Amy out, but that's okay. If it comes, that's okay. We'll just see.
Betsy.
Okay, Betsy, congratulations. And one more time.
That was a close one.
And Shirley. All right, Shirley, Betsy, and
Amy C.
Amy C. Congratulations, and thanks for sticking on until the very end. And we hope you had a great educational experience today. There was still so much more to talk about. We didn't get to it, and maybe what we'll do is we'll offer it as a webinar for membership. We could basically give a webinar every day and throughout the entire year, and we would still not be done. So anyhow, we hope you had a great day, and we'll see you tomorrow when we will be talking about exercise. Good night, everyone.